The Russians continue to target healthcare facilities. In total, about 1,500 healthcare facilities have been damaged or destroyed by Russian missiles and bombs, most of that intentional.
Progress in addressing this issue is underway. AMC-Healthcare, in partnership with Northwell Health and Ukraine Focus, is leading the way in rebuilding the healthcare infrastructure in Ukraine. The Convoy of Hope, led by donors and volunteers, transported 50 ambulances from Normandy to Bucha. The connection to D-Day celebrations symbolizes the enduring freedom Ukraine and their allies are fighting for.
Each ambulance is said to save about 250 lives in its useful life. And the Russians will destroy them or they'll get beat up. But in the meantime, each of those ambulances saves 250 lives. It's great to be part of that kind of exercise.
Along with the ambulance delivery, the team was able to see the groundbreaking for the new AMC-Healthcare hospital in Bucha.
I am so grateful to be here this morning, and I am here because of the hard work of Ukraine Focus under Brock's leadership. I am here because of the incredible foresight and generosity of AMC. I am here because of the Territorial Defense Forces who helped us get across Ukraine. Thank you for helping to drive these ambulances. I am here because of the hard work of many volunteers, many of whom had to go back to their homes, but who were driving these ambulances across Europe because they believed in the mission and they believed in how important it was to get these ambulances here.
Кожен не соромиться, закладає побільше, щоб вона по кругу зайшла абсолютно.
Progress on the site is impressive, and it's incumbent on us to now get the building built, get the engineering finished, and get this up so that we can start seeing patients this fall.
The Pataki Foundation, which has been a huge supporter of the humanitarian efforts in Ukraine, recently said,
I strongly endorse this project and Mr. Yesin, and I urge all stakeholders, including local Ukrainian authorities and international partners, to provide the necessary support to ensure its successful and timely completion.
Just like the ambulances in the convoy from Normandy, initial funding for the design and engineering, equipment programming, and purchases were provided by private donors and supporters. Since then, a bipartisan coalition in Congress agreed to provide much-needed support.
Thus far, donors have carried us to the point where we've done site selection, we've done programming, equipment programming, design, and now we're getting ready to build. When Congress appropriated this money, it did it with specific request that several billion dollars go to humanitarian economic assistance. That is hospitals, and that is healthcare delivery. So we are tip of the spear. There isn't any other way to get these hospitals open on the ground and as a permanent asset in the Ukrainian healthcare system. They're doing everything in their capacity to defend their country. We've provided them weapons, but we now need to help them rebuild the infrastructure that is their healthcare system. And that's mental health and physical health, and that's what these facilities are about. The first hospital is going to be a combination of a mental health care facility and a rehabilitation hospital.
This is what the taxpayers asked for. Tangible proof that their money wasn't just going to prolong the war, but to win the war and start rebuilding families and communities, just as America did within a few short months of the D-Day landings.
You want accountability, you know exactly where it's going. You want transparency. 90% of the dollars are spent on American companies for American medical suppliers and American laborers to build these in our area of expertise, something we do better than anyone in the world. No one wants Chinese hospitals. Okay, they want American hospitals, and we're going to give them American hospitals, and we're going to give them the best hospitals in Ukraine and some of the best in Central Europe, and we're going to do them now in the next 12 months.
Substantial private sector support will still be essential to equip and open these hospitals. In order to get to that point, the federal government must act now.